Good evening, everybody. Welcome to this meeting of the Adult Health Overview Scrutiny Committee. I will start by asking if there's any apologies. I'm aware of Councillor Bignell. Do we have any other apologies, James? And is anybody else aware of any other apologies for the meeting? No, thank you. Item 2, declarations of interest. Will any members declare any interest they have in any items on the agenda? Okay, none noted. Okay, item 3, the minutes. If everybody had the opportunity to read the minutes, is there any questions, any queries with the minutes from the previous meeting? Are we happy to sign them as a true and accurate record? Lovely. Thank you. Okay, item 4, Chair's announcements. So obviously this is the last time that the Scrutiny Committee of this Council session will sit, so it's quite an interesting occasion. So I'd just really like to make a few thank yous to people, really. I'd like to thank councillors for their attendance and their contributions. I think this has been a really good committee to chair, and I think we've got started to get to some really good decisions and some really good stuff that's going on here. I'd like to thank James for his support, because without which none of this would really happen as smoothly as it does. So I'm very appreciative. I'd like to thank Councillor Connolly for the time he stood in for me when I was unable to come, so that's very much appreciated. I'd like to thank the officers for their support, and I'd particularly like to say thank you to Stuart, as it's his last scrutiny and he's leaving the council at the end of the week. So thank you for all your contributions and your advice that you've meted out. We will be showing later on, sharing our report on the work that Scrutiny have done over the last year. So that's one of the items on the agenda. So I think that's it for my announcements. Okay, so moving on to item 5. So the adult social care self-assessment and performance. So I'd like to invite Neil Cox, the Director of Adult and Social Care, to introduce the report. Except he's not here and you're going to do it instead. I was going to say.
Apologies, Chair. So you've got the full complement of adult social care assistant directors and director here tonight. As you've alluded to, Chair, this is my last scrutiny session. I want to do a bit of an intro because I need to provide scrutiny with an update in relation to our CQC assessment process, which has now started. Once I've kind of done that, I am going to hand over to my colleagues to kind of take you through both the self-assessment, the priority action plan, and the performance indicators that we've got on a slide set to kind of take you through. So on Monday last week, as we kind of predicted, we had notification from CQC that we would start our assessment process. The assessment process is different to that of Ofsted, in effect that there are 3 stages to CQC's assessment or inspection process. I'll mix my language up as I kind of go through it. The first stage is the information return. So on Monday, we received our requirement to submit our information return. We have 3 weeks to submit a whole host of documents, process, pathways, data pertaining to the work that we do on a day-to-day basis. That information has all got to be submitted by the 28th of March, so next Friday. We're in a good position in a sense because we've been focusing on assurance now probably for the last 18 months, 2 years, and given that our friends across the way, Northants, had their notification of starting their inspection journey probably about 5 or 6 weeks ago now, we felt it was inevitable that we were going to get the call to actually start ours. That's because CQC have tended to group local authorities in relation to integrated care systems. The other bit is that we and is it Derbyshire? Nottinghamshire are the only two authorities within the East Midlands who haven't had their inspection framework started. They've had a bit of a dispensation because their DAS is currently the ADAS president. So with that in mind, we actually kicked off a mock information return some 3 weeks ago. So we're now in the position where we're starting to finesse the documents that we're going to submit. So a lot of the content that we're going to take you through tonight is a feature of what we will take CQC through. So once we've submitted our information return next Friday, CQC's policy has that they will get in touch with us in order to conduct our site visit within 6 months of submission of that information return. So from Friday, we then go into stage 2. That's where CQC, behind the scenes, start triangulating the documents that we've put in front of them alongside any information or data that sits within the public domain pertaining to our performance as a council. As I've said, within 6 months, CQC will give us a notification of that site visit. When we get that notification, we will have around 6 to 8 weeks advance notice that they're going to land on site. When we receive that notification, we also have to provide 50 cases to them. The 50 cases that we present have to be reflective of the people we support on an ongoing basis. So we support around 4,000 people on an ongoing basis. And if 60% of those are older people, then 60% of the 50 cases we put in front of CQC have to be older people. Equally, we need to reflect the demographic makeup of our communities in that sample that we provide. That sample also needs to include carers. Again, it's a bit different to Ofsted in a sense. With Ofsted, they ask for the totality of details pertaining to all the children that an authority is working with. For us, it's very much about us identifying 50 cases that are reflective of our active client group that have been assessed or reviewed in the last year. CQC will identify from those 50 cases 10 that they will focus on, that they will audit. They will want to meet our workers, they will want to be people who use our services and carers in order to understand their experience of being supported by us. CQC, as part of their site visit, will meet with Neil as our Director of Adult Social Services, with Councillor Goby as portfolio holder, alongside an array of different staff from WNC. They will want to meet with our voluntary sector partners, our providers, our NHS partners, and as I've said, they want to meet with people who have actually received support from us. That kind of gives CQC a real opportunity to triangulate all of the information we've submitted to the information that's in the public domain and then the experience of the site visit. Once they've completed all of that activity, they will start to put together a draft report. That draft report comes back to us. We have an opportunity to check that in relation to factual accuracy. It then goes back into the system for it to be moderated. So they look at how we've been scored in order to make sure that there is a level of consistency in relation to the inspection format across the board. So as it stands, we've started to engage our staff. We did a big briefing last week around the fact that we are going to be pulled in kind of competing directions because we've got the day job to do as well as preparing for assessment. What we've also really focused on is, for us, we really feel that this is our opportunity to shine. This is our opportunity for us to convey, not that we're perfect, but that we've delivered a significant amount of change for local people, that we have used this opportunity to reflect the work that our social workers, our care workers do on a day-to-day basis, 7 days a week. We very much believe and have assessed ourselves as being a good authority. And in that sense, our expectation to convey to CQC is that if they came in 2 years' time, we would be an outstanding authority. We recognise that since the creation of the council, we, at that point of creation, were probably a requires improvement authority as we stepped into safe and legal. But if you look at the different things we've taken forward, we're confident in our position as a good authority. So in that context, the self-assessment that members of Scrutiny have seen on a number of occasions now is being finessed LMS to ensure that when we submit it, it is an absolute accurate depiction of where we are. That self-assessment will go out far and wide, and we've done a level of engagement and consultation around partners and staff to make sure that people recognise it. Equally, the strategy document and the performance indicators will be a feature of that inspection. So this is very timely in relation to our opportunity to kind of take Scrutiny through where we're up to give you an opportunity to check the robustness, particularly of the improvement plan that we've got in place, and to give us a level of challenge pertaining to our performance against some of those indicators that are not necessarily where we would want them to be. So on that note, Chair, if it's okay, I'm going to stop and I'm going to hand over to Neil in the first instance to take you through. Thank you.
Thanks, Stuart. So with the papers that have been circulated for the meeting, members will have received the action plan against the self-assessment, which is built on the back of the self-assessment document, which was previously presented at the last meeting, but has also been circulated with the papers as a reminder for members of the committee as well. So the action plan is structured around the 4 themes of the local assurance framework, and the main body of the report outlines our aims and objectives, which have been identified following completion of the self-assessment as areas that we need to work on for the coming year at least. The appendices then go into more detail around the specific actions which will support the achievement of the aims and objectives within the overall plan. So in summary, theme 1 around assessing needs really focuses on us needing to enhance locally designed support for people so they can utilise the assets within their community, making sure that they've got accessible information and that our services are responsive, understand the demands that they're seeing, and also managing any potential risk within those demands as well. We also highlight the need to formalise and embed our strategic approach to prevention, which is a key piece of work which we're moving forward very quickly at the moment. And as well as this, increase our engagement with underserved communities to ensure that we're meeting the needs of our whole local population and that people are able to achieve equity in the outcomes that they get from social care support. In the second theme, around care provision, we've highlighted the need to continue development of our independent care sector and also at the same time maintain our work around ensuring the availability of high quality care, as well as strengthen our partnership work not only with with local partners, but also through embedding our co-production strategy, which was a key piece of work which was taken forward last year. On the theme around safety and safeguarding, ensuring safety and safeguarding, we've identified the need to improve outcomes for our most vulnerable residents and utilising all local intelligence and support that's available to achieve this, as well as continuing to improve our safeguarding offer through understanding the experiences of people who've had to go through the safeguarding process. And then finally, in the last theme around leadership, we'll continue, and it touches on a lot of what Stuart said in his introduction, to evolve our approach around the governance and oversight that we have of operational delivery, which includes implementation of new systems and new processes, as well as utilising opportunities which provide us with feedback to shape the future of services that we deliver. And we want to make sure that we've got a big emphasis on taking an innovative approach to the future delivery of care and support. And to understand how we're delivering all of this, as outlined in the report, we'll use data, feedback, both from internal staff and from people who we support, to measure our progress and then make sure that we're achieving against the action plan that's set out, with a view to updating that action plan and that self-assessment towards the end of the calendar year. So we move into that same process of refresh, update plan, and then delivery. So that's really all I wanted to say in terms of the document, because obviously people have had it to review, but happy to take any questions on that through you, Chair.
I'd just like to ask a quick question before I hand it over to the floor, and that's more to do with the journey that we've been on. So you said you assumed that the level requires improvement beforehand, and obviously I can see the significant stuff has happened. My question is around, when are we likely to get some feedback on where we are from this process? Because I know from CQC audits, they're usually in a dialogue with you throughout the process. So it won't be a surprise when you get to the end and they go, this is what we're finding. So, and I'm trying to plan ahead here to when we might get some feedback, or the next organisation might get some feedback. So my question is about that process. When are you likely to get some feedback that you'd be in a position to share with future scrutiny committees?
So, combination of answers. So my personal prediction would be that our site visit happens in August. If you think then around the moderation process kind of playing through, my view would be that we would see a document that we've had an opportunity to contribute to that has been moderated, probably within about 8 weeks after the site visit.
Yeah. What they don't do is they don't give you an indication when you're on site. So they'll meet with the DAS on the last day to sort of feedback, but what we're being told is that feedback's not helpful. So I think some authorities have had the feedback and thought, oh, we were good, and they've become a requires improvement. So yeah, you really have to wait till the report, unfortunately, to get the real indication.
And my other question about the process is they're obviously going to talk to some people that are receiving the service. You talked about your 4 themes. So is there enough of that going on to spread over those 4 themes to get the feedback that you need, that those 4 themes are being properly supported and are performing as you would expect them to perform?
Yeah, I mean, we've got a number of measures in place around sort of eliciting feedback. So we did talk a bit about engagement at the previous scrutiny session. We've implemented QR codes on our formal sort of letters and correspondence that goes out, which allows people to provide that level of feedback. We've got our co-production strategy in place, as well as our experts by experience, and also then we're sort of tapping into our networks through local area partnerships and community working as well. So yeah, I think we're comfortable with the level of feedback that we're getting at the moment. As we move closer to that assessment, we'll start to sort of engage people more around the things that CQC may be likely to ask, as well as reviewing the cases that we're putting in front of them as well.
And my last question is around where you think you'll land, where you're expecting to land, because again, you'll be doing all this research beforehand, so you should have a good picture of where you expect. I know that's not guaranteed, but I'm just curious as to where you think you are.
Yeah, do you want to?
So we self-assess as being a good authority.
Yep.
So that's not to say that we're perfect. There are things that we need to improve. There are a number of indicators that we contribute to from an East Midlands perspective that give us that kind of understanding. So CQC are particularly interested in certain data. So one is around the number of people who are waiting for care because we have a lack of market sufficiency. We don't have anybody waiting for care. We used to. 2 years ago, we used to have about 2,000 hours worth of home care that we couldn't provide, particularly in our rural areas. So the work that we've done from a commissioning perspective, so Ashley's work, has meant that we have got a sufficiency of provision across the totality of West Northants. So we don't have any waiting lists for care. It can take time sometimes to find the right care, particularly for people with complex learning disabilities. That isn't about the sufficiency of care, it's about if we are supporting somebody to live with 3 other people, we've got to make sure that there's a compatibility for the 4 people when they come together to receive their support. So that's one reason why we think we're in a good position. The next position is East Midlands authorities all share information pertaining to waiting lists. So waiting lists for care, waiting lists for assessments, waiting lists for doles. Again, when we look at the data, we're in a good position compared to some of our comparator authorities in the East Midlands. That includes authorities who have been graded as good. So again, we have that level of affirmation that we're in the right space. The other kind of key line of inquiry for CQC is around safeguarding. So what they're really interested in is understanding whether we've got cases that we have determined as a Section 42 inquiry that we're going to progress to an investigation, sat waiting for allocation. Again, we don't have delays in allocating workers. It's one of our absolute priorities. When we determine that something is a Section 42 and we're going to progress, then we allocate and get on with it. So in that context, those kind of big ticket items which have kind of undermined some of our neighbouring authorities, we don't have some of those challenges. Equally, when you look at our internal performance indicators and you look at some of the ones we're going to take you through today, there's questions around things like reviews. So we're not where we want to be on reviews, but if you look at our performance year on year, it's going up and up and up. We have a clear strategy that describes what we do and how we provide support to people. When you look at our indicators around people who have accessed short-term support, we have the legacy of the County Council to take into account, in a sense that all of the preventative services was cut back as a result of the kind of 114 stuff. We have a prevention strategy in place. We've embedded public health staff into our community social work teams. We've been quantifying the outcomes that they've been delivering. We have case examples to take people through. We know that carers and working with carers is an area that we want to improve around. Members will be aware that we did quite comprehensive engagement and co-production around our carers strategy, which we took through Cabinet last year. We've just re-procured Northamptonshire carers to deliver a different array of carer support. So even for those kind of areas whereby we have a level of performance that's not where we would want it to be, we can demonstrate that we've recognised that and we've got mature work in place in order to move us to a position of a performance that we would really aspire to. So it's in that context that we aspire and deem ourselves to be a good authority.
Thank you. Anybody else have any other questions? Councillor Humphreys.
Hopefully that works. Yeah. Thank you very much, Stuart. Just a couple of things. You said CQC are particularly focused on whether people are waiting for care, and you've said they're not. But that's presumably people waiting for care who've been allocated a particular package of care, because we've got. I see in the indicators where amber for waiting for. Looking at the wrong one now. There was something about awaiting allocation for conversation 1, 2, 3. That's presumably when you're deciding what care is appropriate. We're in red, so those people must, in theory, be waiting for care, but they're not sort of through the system. But anyway, it's a different.
It's a different indicator.
Target, yeah.
So the kind of riskiest position is that you've assessed somebody and you've identified that they need care, and then you've not provided it. So when you look at our position around awaiting allocation, we've done a level of triaging of that person's needs before we've kind of put them in a priority order. So anybody where there is a level of risk, we will have provided support. We then have a waiting well strategy, which allows us to kind of articulate to people that we are looking to allocate a worker as soon as we possibly can. In the meantime, should their needs change and get worse, get in touch with us as soon as possible, because then their priority status increases. Equally, it provides information pertaining to other services that they can access in the meantime. So again, we're not perfect in relation to not having levels of demand coming through which outstrips our capacity. What we are good at is demonstrating that we've got oversight and grip on that level of demand. And when you look at the numbers of people that we have in place, we're going to be red because we don't want anybody waiting for care, and that's about articulating our aspiration. But when you compare us to East Midlands authorities, the levels that we're encountering are not as significant as some of the other authorities who we see, and they don't necessarily have that same robustness of understanding of who's in that waiting list.
Just one other thing. You said the authorities being self-assessed is good, which is really positive, but as a layperson, when you see the indicators and over half are either red or amber, you think, oh my goodness, but it's obviously a moving picture, and that's not the fundamental thing in your view.
So when you look at our indicator set, if we didn't give ourselves demanding and challenging targets, you could argue that we're not being aspirational enough in relation to our expectations around how we support people. Equally, the notion of our indicators going red means that everybody's conscious that there is work to do to improve that particular indicator. So when we look at this, I would be more concerned if everything was green, because that would kind of give you a sense of complacency that we're not trying to strive for improvement. Obviously, when you look at those indicators that are red, actually over the year, they flip and change because the tolerances kind of go up and down, and dependent on the demands we see, sometimes we can have really good performance that dips quite quickly, dependent upon people's circumstances of the day. So CQC won't expect us to have everything in the green. They would be a bit worried if we did, if I'm honest. Thank you.
Councillor Roberts.
Thank you, Chair. So first question is around the data, because the report says it was last updated in January. So is the March position similar, or am I looking at something very different? I think that's just a sense check of that.
Yeah, unfortunately, when we had to submit the papers for the meeting, we were in the middle of our migration onto a new case management system. So we're in that process of new dashboards being built. So for consistency around what committee had already seen, we've just referred to the last report. But what it may be worth doing, Chair, if you're happy with this, is potentially having something on future work programme around what that future Power BI dashboard looks like, because that will give us more real-time data around levels of performance.
Okay, so we're shifting from it to a different set of data, so it'll look different, but the performance indicators change. So we'll be measuring different items.
No, we'll still have the same items that we'll measure. It will give us the ability to measure an increased range of items as well, because of the way it links to our system. So we won't lose sight of what we've had and how we've tracked on that. Okay.
So just on anecdotally, without me seeing the data, is the March position still similar, or actually is there 50% red in the March position? I think for me that's really important, that particularly because Stuart said things into, and I accept these indicators will go up and down because you'll have a demand in a particular area, or you might have some staffing issues, or there'll be different variances that will affect your RAG status throughout the process. But I wouldn't mind knowing if March
to give you a really good example, when you look at the March set, then the count of unallocated concerns or inquiries work list at the days of the month, that's now moved to green.
I appreciate what you're saying, but one moving to green could be great, but if all other 20 odd have moved to red, so can you give me on an average position, has the position drastically changed from January to March?
No.
I'm expecting not, but I just need
not as we're aware of,
reassurance.
Sorry. As far as we're aware, and from what we're seeing from the data that we have got, there's no drastic moves at all. If anything, more than 2 have actually improved. So, for example, DOLS, which is another one we'll talk about, we're doing a lot of work to cleanse the data. The new system's given us much better oversight. So actually the data's going to be more accurate, and actually is looking like more of an improving picture. And we're not seeing increased demand levels either, anything like that are out of the ordinary. So no, we're pretty confident we're stable.
That's really helpful, and I've just got a few more questions, Chair. So one of the things that, and the CQC might not care about this, so you might tell me it's irrelevant, but one of the things I can't see from the action plan is it's where the reds are red, and I accept we will always have reds and we will always have ambers, and I'd be worried if it was all green. I agree with that. But what I'm not clear on is the trajectory of the reds to ambers, the ambers to greens, and where we would expect to see acceptances of tolerance levels. And that's, I don't think that's detailed, and I don't think that's documented. And for me, or certainly for future scrutiny and for Cabinet, I would expect them to want to see that we weren't complacent at red and amber, and there was a level where we wouldn't accept it falling below, or there's a level where we would expect it to, go up at per month. Or I'm no expert, so I don't know the detail, but I wouldn't mind seeing that.
Yeah, certainly. So we've got a separate slide set around the indicator, so we can talk about the trajectory and the position with the red. So we can do that shortly. I guess probably just to make the point in terms of the action plan on the self-assessment. So the self-assessment is essentially around our assurance framework and our sort of governance. So we won't talk about there'll be elements of performance which get reflected into there. Our overall sort of management of performance is something that also runs alongside the quality assurance elements that sit within the self-assessment sort of plan. So, yeah, it may be helpful if we go through the indicators slide set, and then the relevant assistant directors can talk to you about the trajectory and those ones that are red and what we're doing, because they're slightly separate conversations.
Brilliant. I'll pause the further question on that until we look at it. There's reference in the report to local area partnerships, and we've put quite a lot of emphasis on local area partnerships being an improving factor in our care provision. I mean, I've got a personal view on local area partnerships in that they failed and that they haven't been successful, and they certainly haven't delivered in my area what I expected them to deliver. How significant of an impact do you think that is, or has had, or will have on the work that we've done, and how will we get that to improve further? And then I'll finish, because one more question is, whenever I log a referral with adult social care, whether that be a safeguarding referral or a request for support, facilities grants, whatever it is, I've praised it before, I always get a proper acknowledgement with a formal letter acknowledging the log that I've made and how long it'll take to get my inquiry dealt with, and then I always get a proper written response. I just wondered if there'd been any consideration of taking that, which I think is a really good process, into our other areas, because that doesn't happen in children's, for example. If I log a send inquiry or any other type of safeguarding referral into NCT or into the local authority, that doesn't happen. So that was a praise, and could we perhaps look at moving those processes into other areas?
So, in relation to our local area partnerships, have they fully delivered against our expectations across the board? No, they haven't. Have they put us really far forward in relation to the neighbourhood health guidance, which was published by the government on the 25th of January this year? So the neighbourhood health guidance, in effect, requires local health services to provide a consistency of ways of working that fits with our LAPs and our neighbourhood community teams. So there is an ICB development day tomorrow, whereby we will be putting forward the LAP footprints that we've established alongside the 5 community social work team geographies which sit on top of the LAPs, will be adopted as the neighbourhood geography for our place. That same methodology will be taken forward with Northants. That will mean that every service that NHFT delivers will be delivered on the same geography that the local authority is delivering its community social work teams. Those community social work teams sit on top of that LAP geography. The narrative that we're taking forward through the ICB Development Day tomorrow is about being really clear about the roles and responsibilities of the different levels of geography that we have in place. Our local area partnerships have to be focused around working towards improving the wider determinants of health. I think particularly after the elections, we need to have a level of relaunch for the local area partnerships to be really clear around what they give to members. So I say that in the context of, as we move forward, those local area partnerships will reaffirm their priorities based on evidence and need. For members, the local area partnerships will give them a mechanism to support improvements within their local constituencies. So rather than having to engage different organisations in relation to particular constituent concerns, there will be the opportunity for that to be aggregated into those LAP discussions. So it moves from members, in some of them being passive participants, to actually being active leaders in that space and using that forum in order to improve the kind of wider determinants, whether that's housing, whether that's safety. So all the alignment that we've managed to land puts us in a really good position to move that forward. Equally, when we do the relaunch, there needs to be a conversation about how future resources in some way or form might be attributable to local area partnerships. Don't get excited, I'm not talking about multi-million pounds, but when we look at our community and voluntary sector investment, we have to, if we're embracing this notion of being an evidence-based council, enable our geographies to make informed decisions around particular investments that will bring about benefit for local people. So the ICB development session will look to affirm that kind of rationale around the wider determinants at LAP level. It will look to affirm the neighbourhood geography. If I'm honest, the neighbourhood geography is the really exciting stuff. Members absolutely will be aware of the Prime Minister's statement around the abolition of NHS England last week. When you start to join the dots up between that neighbourhood health guidance that was published, the abolition of NHS England, the bit that didn't come through very clearly is that all ICBs have to reduce their costs by 50% by December. Now, the only way they're going to do that is to either merge into great big health authorities, which then creates a challenge around devolution geographies, or they need to delegate functions to local authorities. So members will be aware that I've had an aspiration around continuing healthcare since I came here, about being able to lead that, to stop people being pulled from pillar to post in funding streams. That's the sort of delegation that the neighbourhood model will start to take us forward. So when you look at where we are on LAPS, is it perfect? No. Has it produced a platform for us to jump really quickly into the expectations for 25-26 for the neighbourhood health guidance? Yes, it has. And thank you for the feedback. In relation to the kind of amalgamation of good practice, that's one of the things that we will start to consider, because we're doing some of that, for example, in Ashley's area. The creation of our integrated commissioning structure will mean that we have a single payments team. What I can say, and I have got the evidence around this, is that the complaints are slowly starting to reduce down in education terms. What I can absolutely say is that as of today, I don't have any complaints out of timescale, any member inquiries out of timescale, or any MP inquiries out of timescale. So Mel's doing a really good job of kind of putting a robustness to that, but I appreciate that the adult stuff is a bit more mature and we need to learn from it.
It's really positive, the commentary you've made around the LAPs, because obviously we don't get to see that level of detail, and the LAP function itself hasn't functioned. What I would say, though, is when it initially started with its allocated resource, it was really positive, and we were starting to have proper community conversations, and because I sit on the meetings, I saw the outcomes of those community conversations, which were really positive. It was the reduced resource that then diminished any possible activity, and I have to say the lack of member engagement was awful, personally, in my LAP. Obviously, only certain members were sitting on the LAP, but just want to make that point. It was really bad. And then just on the complaints point, I wouldn't mind having a look at that data, Stuart, because as of 2 days ago, a complaint that was 3 months out of time was only just responded to. So, thank you.
Councillor Golby.
Thank you, Chair. I was just going to challenge Councillor Roberts back on a point around the LAPs failing, because, in my opinion, I thought that was slightly careless and ill-founded because of all the great stuff that Stuart's just talked about. And in my opinion, I think the LAPs, as Stuart said, is is going to provide us with a fantastic platform to move forward. So I also accept that they're not all perfect. It is about the people that you get round the table. And if I'm back in my role, we all, you know, we've got all got that caveat. I've hopefully been able to see the opportunity right from the word go that these present. So I'm going to keep pushing them, and we want to make them work, and we want to get the right people round the table to make them work. Thank you.
Councillor King.
Thank you, Chair. I thought you'd forgotten me.
No.
I think we're quite lucky, Councillor Gold, because we had a very positive lap that we served on, and we got some good results, including a community day that we did. But others are completely different. I've heard positives and negatives. But my questions were around how do we measure communication with families? So once the people have been into hospital or waiting to go into care, I've had 2 cases in the last month. One, unfortunately, has ended tragically. The second case, we've managed to help and get the person put where they needed to be. But in both situations, the people have been in hospital, someone's been to assess them. One family member was moved to Rushden. The family weren't informed, nor was her husband. The other person was moved to an incorrect care home. So I know from those 2 cases, if they were picked, we'd have a very negative response. Of course, people do only get in contact when it is negative, and it's not that often, but those 2 do seem very worrying to me.
Yeah, so discussing sort of particular cases, particularly around hospital discharge, can be sort of slightly challenging because there's a number of different stakeholders involved in that discharge process. I think what I would say is anytime there are concerns about particular cases, if they can be raised with us at the earliest possible point, then we can make sure that we look into them, because without going too much into the detail, we get involved in discharges to some facilities, hospital get involved in discharge to others, and you know, it can be hard if we don't know who's actually led on a particular discharge or a case. What we have got and what's sort of featured in the self-assessment are some clear pathways around ensuring that where we undertake discharge and return people back home, that it's done in the safest possible way, that we've got consideration for their needs, and we're doing that as supportively as possible. So yeah, we work on that basis. Apologies, there was another point I was going to make, which has just completely slipped my mind.
We can email it to you. The other thing, and
it's particularly sort of in Emma's world around that whole sort of discharge approach. What we have got is extra capacity within the hospitals to make sure, from a social care point of view, that we are sort of contacting as many people at the point that they're coming into hospital to understand what potential sort of route out that they're taking, and working with health colleagues to make sure that those cases that you've sort of highlighted are minimised as far as possible. But yeah, absolutely. I think the message is anything that doesn't look or sort of feel right, let us know. Whether it's our discharge or not, we can work across partners to make sure that people are supported in the right way.
Councillor Ashraff.
Thank you, Chair. It's about an individual case, but I won't go into too much detail, but it does refer to discharge. When an individual lacks capacity in not able to see and has to be placed somewhere in the community, but then is asked to move out of town, but then access the hospital locally 3 times a week for dialysis, it becomes really difficult to help somebody in that situation, because they've been ping-ponged around different areas when they've got concerns of illnesses and ongoing illnesses. Do we try to help people to stay as local as possible? I mean, I'm sure that's what we try to do, but when somebody's blind, how does their voice get heard? Because they can't see what's in front of them, but the representatives are not listening. So I just wondered, you know, this is a unique case because of somebody being blind. and needing a lot of health support. So it's a difficult case that I'm actually dealing with at the moment with the agencies, and she's having to represent herself in most situations because of the amount of medical appointments she has to attend.
Yeah, I mean, certainly it sounds like we may need a conversation outside of this meeting just to pick up some of the concerns there. Yeah, what I would say is we want to make sure that as many people, we want to make sure that we've got the right support, care and support available within West Northants for people who live in West Northants. We don't want people to have to be placed out of area. Sometimes there are circumstances where our market may not be able to respond, and where that is the case, then we do work with providers to shape and develop that, and Ashley can tell you more about that in future. I guess the other thing as well, where people are in particularly vulnerable circumstances, what we can do is provide support of an advocate, so that they don't feel like they're necessarily sort of fighting the corner on their own, and we've got contracts with advocacy services that can support with that. But Ashley, if you want to pick up the out of area issue.
Yeah, no problem. So all of our commissioning strategies outline a very locally focused approach to delivering care and support. We have rich volumes of provision across, and lots of capacity across, hence Stuart's comment earlier about people, once they've been assessed, not having to wait so long for a care package to start. Lots of it. It's all based upon when people do have incidents where they are discharged from hospital, that there is either a care home or there's home care provider available near to where they live, and that might not necessarily mean it's in West Northamptonshire. It might mean it's on the border of Oxfordshire, or it could be just over the border in North Northamptonshire. But we contract in that way, centred around where the people live, to make sure we've got enough provision around it. And that approach has been really effective, because the number of out-of-area placements we've seen have steadily reduced, and in 2020 425 so far, although there's a few days left. We've had 9 out-of-area placements, and all of those were because of people's choice to live with family. All others have been based around the areas that they live, and when we do place people, we always take into account the choice that they want to make in terms of where they live as well. So it's all built within our commissioning strategies. So every attempt is made to keep people somewhere close to where they're familiar with and where they're more likely to experience better outcomes.
Okay. Councillor Humphreys.
Thank you. Through you, Chair. Just one question. On page 23, you refer to the sort of context and previous strategies. So can I just read it? As we become more mature as an organisation and as an adult social care service, we recognise that we need to bring our focus to reviewing and updating the previous strategies we work to as a county council. Are there any strategies we're sort of still working to, or is that a misreading of that?
No, well, we're in the process of updating policies and procedures and making sure that they're reflective. I think during the course of the year, we've obviously implemented the carer strategy and the co-production strategy. So I think there's no county council strategies that necessarily sort of guiding our work at the moment that's essentially sort of on the wrong geography. What we may need to do is sort of relaunch new sort of strategies as we move forward, which may have been present which may be present in more sort of established councils and adult social care directorates, which sort of give that sort of clear statement of intent around particular areas of delivery.
Thank you.
Councillor Roberts.
Yeah, thanks, Rosie, because that's really helpful. Just to follow up on that, I appreciate we might be talking about just updating the document, that the vision isn't now the vision that we're following, but are there any people-facing strategies where people follow a process that, was an NCC process that then drops into ours that is different, so they perhaps get sent to the wrong place? You might not be able to answer that, and I might be talking complete rubbish, but if there are still strategies that harp back to NCC, that would worry me, that they would go through an NCC process and then drop into a WNC process that had a different vision and a different intent to it.
I'll
pass to you in a sec then. So in relation to, and it's a really valid point to raise, we probably need to actually take it out of the self-assessment. So when we first wrote the first iteration, we were still working through some of our internal policies in adults. We did a gap analysis just to make sure that we haven't got any gaps. I think the final one was the direct payments. This isn't a strategy, this is a policy. Was the direct payment policy, which came to Cabinet this month, last month? This month. So that's now West. So yeah, I think actually we are not in that position any longer. Yeah, I think it is. In relation, I think you, member, might be talking, you're going to respond, I think, a particular one.
A really good example of this is we've got a particular policy that's coming through our senior leadership team tomorrow. So the County Council dealt with people's appeals against the decision that they're not eligible from a Care Act perspective under the complaints procedure. The Ombudsman has provided recent guidance that says actually if somebody's challenging your eligibility decision, you shouldn't treat that as a complaint. It should be an appeal. So the document that's going through our senior leadership team tomorrow creates an additional policy pertaining to appeals. People have been able to appeal, but it's gone through that, what was the original county council approach. So some of the narrative in this is like a catch-all that says if you see something within our documents which might not fit a bit, it is about that transition into WNC and us having that kind of programme of work that gets us to a point where these absolutely reflect our direction of travel and where we're going. But in strategic intent, you won't find anything that's obtuse.
That's really helpful, Chair. I walked through you. I wonder if there's a recommendation that the gap analysis, forgive me, sorry, that was the lady's name, I didn't catch it. Amy, thank you. The gap analysis that you've done in respect to the strategies, perhaps there's a gap analysis in respect of the, I'll call it policy for want of a better descriptor, that could perhaps be done as a recommendation that Cabinet checks and sense checks that, or certainly the Cabinet member checks and sense checks that those policies are all up to date and, yeah, where they need to be.
Councillor Golby.
Yeah, there was a time when I sat and looked on the website and picked out all the old policies and sent them to Stuart and said, what are we doing about these, basically? And I'm pretty, satisfied. I think I'll have another look now to say that they've all been updated and done appropriately, basically.
Well, Stuart just reference one that's going to SLT tomorrow. So, whether that's a forward on our website-facing policy or not, if we could, I still think there's if the committee agrees, obviously that there's a scope to look at whether there's a gap analysis. I loved the example. You'd identified one, you've now fixed that one. It's just another reassurance process to scrutiny, isn't it, that we are delivering. And I've said it before, I think there should be huge praise heaped on all of the work that's been done in adult social care. I think the way you've informed this committee and the work that's been done previously has been excellent. Whether Matt and I disagree on the lapse or not, it's a different matter. He's not here to challenge me. We're here to challenge the Cabinet process. But I would just think that that's a good recommendation, Chair.
So thank you. I agree, and I think that's something we can consider putting forward with the committee's agreement. However, if there are no further questions, are we moving on to KPIs, Neil? Yep. Do apologise. Councillor Davenport. Well spotted.
Yeah, I'm struggling a bit tonight because my hearing aids are not working, so I'm trying to lip read and it's been difficult. I don't know whether Matt realises, but he always puts his hand to his mouth when he speaks. But that's not your fault. Obviously, it's mine. So, yes, bear in mind I've been struggling. But I just wanted to sort of round up and say that I have noticed a vast improvement from the beginning of Stuart's time here and the beginning of this council, because I was always sending in complaints, and although you always deal with them, I've never had one that's not dealt with. And for example, with Councillor Kings, I would just contact you and it would be sorted. So I want to say that and the account systems and everything is getting better. And the only thing, as you know, that I'm left with is respite. And that's the only thing. Otherwise, because I see us, the councillors, as the complaints department, and I can, you know, sort of reference going back how things have improved, and I'm not getting as many problems, and any odd ones I get go to Stuart, and miraculously they're fixed. But yeah, it's still respite.
So I'm assuming that the complaints are the ones that end up on my desk as well about lack of provision around respite. I think it's probably a good time to reflect on the story about that, because one of the unforeseen consequences of disaggregating was that the in-house respite service that we had for people with a learning disability was in Corby in Northamptonshire, and whilst we had people who were able to access that service, it wasn't ideal for them. But eventually our access to it, due to refurbishment work being done by Northamptonshire Council, was removed. And that kind of put us into a bit of a difficult situation, and a bit of a challenge that we had in terms of having sufficient respite to meet the amount of traffic coming in from people asking for respite. And the volumes of people, there's never been a massive amount, but it has, because it's not numerous numbers of weeks of stays per year, that it was quite a lot of business that was sort of like not being focused on properly. So we looked at our approaches, and we considered building something internally to be run in-house, but at the same time, we had a number of independent care sector providers coming forward saying, we want to help you to meet these needs. So we've had 2 further respite homes come live, and we've got about another 5 where private organisations are developing them with capacity. So we're kind of working through contractual arrangements for those as it stands at the moment. But whilst it has been a challenge, it has eased off, and I would say it has eased off in terms of the number of people waiting. There's still a little bit of work to do, but I imagine in a year's time we'll be in a position where we think we'll have quite an abundant or buoyant respite market.
Yeah, the thing that I've noticed, because is it 3 now that have happened, and it may be all due to financing for particular care homes, that they say, oh, we're no longer going to do respite. So is that because they're not, the occupancy is not to full capacity due to keeping it there for respite?
I mean, respite is a complicated financial model, largely because it's a care home. Yeah, it's not a community setting, so it's a care home setting, which means that things like housing benefit and rent isn't applicable. So when the council purchases it, they purchase or pay for, in effect, the rent and accommodation, food, utilities, etc., etc. It's expensive. Where the challenge comes in is when the financial model is built upon that respite facility being fully occupied, but when it's not fully occupied, and especially if it's, say, a 4-bedroom care home, then it's quite a financial impact on providers, which is why it's been less appealing in the past. But I think we're kind of moving away from that now. We have to obviously protect the council's financial interests about getting into agreements that might not work well for us in the future, but we're scoping out our strategy for that. But at the moment, like I said, what we've got coming through, we're able to meet needs, and sometimes it just takes a little bit longer than we want it to.
Yeah, I mean, I must admit, when that last care home, was it Bedford, can't remember, said to people, no, we can't take you, it didn't take too long to get them the respite. So yes, it is getting better, but that's the one thing that I do hear most.
Okay. Now can we move on to the KPIs, please?
So we've got the slides which I think everybody can see on the screen. So if I just talk through the introductory slides, which I think people are probably aware of because as a committee you've been receiving these reports for some time. So this is a general sort of overview of the indicators that form our directorate scorecard. As you can see at the top, we've got 50 indicators and 31 of those are RAG rated. Ones that aren't necessarily RAG rated may be around areas that we track just to understand things like demand and things coming through the door, but we can't necessarily control in terms of performance, but we just want to understand what's happening within our teams. And then we've got a breakdown by the different areas and the different owners of those performance indicators. So on the next slide, so these are all the areas within the scorecard which are showing as green, and or reasons to celebrate, so a movement from the previous month out of red or amber, and as you can see, as we were talking about earlier in terms of that fluctuation, some indicators have moved straight from red to green, some have moved from amber, but that just gives us an idea of the direction of travel for them. On the next slide, these are so we have this in where indicators have started to turn amber so that we can start to understand if things are on a negative trajectory. So we can ask questions early about whether there's any issues in terms of those indicators and performance there, but we may not necessarily do a deeper dive because they're not in a position that's causing us concern, but it does prompt us to make sure that we keep an eye on them. And then on the next slide, these are, sorry, just wait for it. These are the indicators that are red, which the assistant directors will talk through in more detail now, where we go into a much more deeper sort of understanding of what's causing the indicators to be red, what are we doing to mitigate that, and when are we likely to see an improvement. Stuart?
Just before kind of assistant directors to kind of take you through the individual indicators, just to kind of highlight one of the improvements that we'll see from the new system. So if you look at the performance data that we've got here currently, that gets pulled out, manually manipulated, compiled against different spreadsheets, put together, and we have a lag in relation to that performance. The new system that we have in place means that we get the vast majority of this stuff in real time. So if you think about our ability to respond to indicators that are on a trajectory that's concerning or not hitting performance, we should never end up in a position whereby we have bucket loads of reds, because it should become a live approach from a performance management perspective, that it's much easier for managers to get on top of this. So when I was in my previous authority, the example I always give, because we've got the same system now, was around open safeguarding cases. So in total, the amount of open safeguardings we're looking at. We'd set that when everything was working well, we would have about 250 open cases. It's higher here because we've got a higher population, in case anybody wants to ask me that question. But everybody knew that that was one of the indicators that me as the DAS looked at. And I had a report that popped into my inbox at 6 o'clock every morning that told me any fluctuations against my 250. So if that was up a little bit or down a little bit, I was fine. But everybody else was looking at that information and then knew if, for example, we jumped on a particular morning to 300, they knew that I would be coming asking the question, which meant before I even asked the question, they already had an understanding as to why we tipped out at 300. So that meant that I would get an early notification that we might have had a safeguarding concern of institutional abuse. So we'd had a bucket load of referrals come in, which has pushed our numbers up. So the move to our new system will mean that Neil can start to embrace that kind of methodology. It requires a level of shift within how our managers work, but their response so far, particularly around the dashboards that we can produce, has been absolutely fantastic. They love the fact that they can see such richness of performance data in real time to allow them to manage their teams proportionately against that kind of information. So that's why you will see an improvement in some of this stuff when we depict it next time.
So if we move on to the first indicators, I think it's Amy.
Am I on? I'm not very good with this mic. So this indicator is in relation to safeguardings. So I'm sure members are aware, but when a safeguarding is first received, it's called a concern, and then we do a triage to ascertain whether we need to process it as a safeguarding or whether we need to take a different action. So, for example, it might be that it's an individual that actually it's a care concern and we want to look at them having some support. It wouldn't then necessarily be a safeguarding because it wouldn't meet that threshold, and we divert it down a different pathway. So this is quite a tight target for this one, because this is looking at the number of unallocated concerns at the final day of the month. So, and apologies, this is a new area. I've just picked safeguarding back up.
Sorry to interrupt you. These slides weren't in my
Oh.
Is there I'm struggling to see that, that's all. Is there a paper version?
Do you want me to email you?
I'll have to look it on my phone.
Do you want me to come and sit next to you?
I'm just struggling to read it, and it'd been helpful for me to be able to read it before. So. But I think other people might be struggling to read it as well, so it's a little bit selfish taking your computer.
You can just read it out loud.
Yeah, I can read the concern. So the actual at the end of December was 21 concerns were unallocated, and our target is that there should only be 17, so we were 4 over in a negative light, hence why it's red. What I can tell you is that the next month, January, we've gone now down to 14, so we're now within target already, and this is one of the ones, going back to the thresholds earlier, that it's quite tight because we are talking about low numbers. Just to reassure members, what we do also look at, though, is the time scale. So actually, from my perspective, I'm not concerned if I have 10 that aren't allocated, as long as they've not been allocated for 24 hours rather than 2 weeks, if that makes sense. If I've got people waiting 2 weeks, that's a concern. But actually, at any point in time, depending on when the data's cut, we are probably going to have people that fall into unallocated. And I think that in relation to this indicator more generally, as you hopefully can see, what has happened since last year is a massive reduction down, and that's a real improvement, and that is in relation to how we're doing the process now. So we've got a safeguarding hub that's a central place that triages everything in one place. We don't think it's perfect, so we are in the process of reviewing and bringing some further improvements to that hub. One being consistent staff members, so we have community assistant team managers on a rota basis currently supporting that team, and we've recognised that actually we think we need a couple of staff that sit there continuously to bring that consistency on day to day. And the other point to raise on this, to give reassurance, is we can't complete the concern, which would then move it on to the next stage, in all circumstances whilst we're waiting for feedback. So some of the reason why there might be a slight delay, like I said earlier, hours, not days, maybe because we're actually triaging it and we need to go and speak to partners, or we need to speak to the individual themselves. So it's not always within our gift, really, in relation to how quickly we can respond. But like I said, yeah, with these being monitored, and it is positive now, it's moving down.
If I could just add one additionality to this. So, as Amy's mentioned, the threshold for this, for red or amber or green on this is really tight. And that's done specifically because the last thing we want to do is have quite expansive targets, which means we could blink, and instead of having 14, we've got 55. If you've got 55 that have been unallocated, they're going to be unallocated for a longer period of time, which significantly increases the level of risk from us not responding. So actually, this is a methodology we use to make sure that we're absolutely prioritising this, to make sure that we never end up with what is a slight increase in demand manifesting as a mountain before we've had an opportunity to address it.
Thank you. Did anyone have any questions on that indicator?
I've got a couple of questions for you. You talk about the amber and the red. So in this illustration, what numbers would yield amber? So obviously 17 below your target would be green, and it's red now at 21. So where would it be amber? Is that 19, 20?
I'm going to have to come back. I don't actually know what the amber of this is, or if we've got an amber. I think we might have, this is the target. If it goes above it, it turns automatically red because of the gravity of this one. Yeah. But I will double check that.
Okay. My other question is whilst I was really glad to see this huge increase right down to 9, there's an upward trend now. So you've hit the bottom at 7. It increased significantly to 16 and then to 21. So that's going up. And I appreciate the margins and the numbers are very small, but that's still, from being significantly under your target, you were at the target and now you're above the target and you're below. So is there anything you can kind of identify as being the cause of that trend?
It's now back down to 14, so we are going backwards. Some of the things are partly in relation to demand. So one of the reasons why we were so high before was we were seeing 5 times the number of concerns coming through to what we're now seeing, or the number of things that were being processed as concerns. They weren't concerns, that was the issue. We were processing everything as a concern. We're now not doing that because we're recognising we need to do further triage. So I suppose what we could probably provide is what's the last 3 months have been, to give you that reassurance that it's not continuing to go up. It has come back and it is stabilising again.
Thank you. Councillor Humphreys.
Thank you. Just wondering if the new system you made reference to, will that sort of include these nuances like X number of cases have only just arrived, so they won't be of great concern because it's only day 1 or whatever, or will it still sort of be a bit of a blunt instrument, but it's really useful to have the detail behind it. Thank you.
Yes, no, we will be able to report much more detail. So some of our internal reporting, well, it's not reporting, our internal dashboards previously gave us the timescales, but our new reports that Stuart was referring to give us the timescales for everything. So at any point in the day, I can now look, I don't have to wait till the end of the month. We can look and see how many safeguarding concerns are the team currently working through, what are the timescales for those concerns. We also have, as part of our weighting prioritisation tool, we have escalation points. So if somebody has been prioritised as it needs immediate action, so very high priority 1, if that was still unallocated at the end of the day, it has to be allocated, it has to be escalated to the team manager. So we've put in other controls to make sure that if I wasn't to look at the reporting, the staff on the ground recognise what they need to be escalating and we can make sure it's dealt with. So we are assured then that even if we do have people waiting, that they're lower priority and they're waiting for the shortest timescales, and we can monitor that.
Councillor Roberts.
Don't get me wrong, I think this data has come a huge way since my first scrutiny meetings, when we just got slides of where we'd like to be. I think we gave you some ideas of what we'd like to see, and I think you brought that to us, from day 1 when you did this. I think for me, all of that anecdotal information that you provide in that kind of tolerance levels and where our tolerance levels are, should be within here for reporting. I appreciate your dashboards will be massive, and particularly if you're now going to use Power BI to do that, but if we could see those tolerance levels, so your target's fine, but if you say actually there is no amber status here, so a drop below 17 is not a tolerance level, but if all 17 of those are today's concerns, then I've got a bigger higher tolerance level on it than I have if they are 4 weeks old, for example. I think that would be lovely to see in here and really show progression. Thank you.
Okay, no further questions.
On to my next one. Thank you. So this is the next stage in the process. So once we've triaged the concern and we've identified that a further inquiry is needed, it would move to this step on the process. This is similar, really. This is in relation to, at that point in the month, how many are unallocated. Going forward, we can provide you with some of the information you've just asked for in relation to timescales. But again, we do have the same processes in place for keeping track of timescales, making sure nothing urgent is waiting. I can also give some level of reassurance that it's reduced further. So you can see on this scorecard, unlike the one previously, where it went up a little bit in November, it hasn't continued, it came down in December, it's come down again even further. And we do probably would be helpful is to also include alongside each of our performance indicators is what our expectations are for the different priorities and measure them against them. So yes, so whilst this was red, it's no longer is red, and on this month's scorecard, this is one that is in amber. So this will have a tolerance level slightly, and I can give you the reassurance that we're on top of it. In addition to just the difference between the two, because we've now seen the reduction in the level of concerns, the number of concerns that turn into inquiries is at 28%, which is much more in line with what we expect and our national or regional partners have. And that was a concern before. We had quite low numbers of conversion rates because we were seeing ridiculous numbers or inappropriate numbers of the concerns. So now we've got a much better understanding of the number of people that potentially are at risk and that we're processing them appropriately. Thank you.
Okay, I'm sorry, 1 second, Emma. My question here is in the element bottom left where you're looking at that breakdown, central team, they're all overdue. Some of the other figures are so low as needs to be here nor there, but is there an issue with that particular team that's causing that they don't seem to be gathering any of theirs on time?
Yes, so what we will have done, and sorry, we should have included it, is anything that's sticking out like that, we would have gone and checked those individuals. And I believe they were data quality issues because the central team isn't an allocated team. So they will now have been rectified and taken off. And that's one of the things that we're hoping with the new reporting, we will stop straight away because we'll see immediately, well, that doesn't look right. Why have we got? So for example, on the new reports, if someone puts a date in incorrectly, or they've made an error and a date says it's 1,000 days overdue, because that will appear straight away, we obviously will be able to identify it the minute it happens and go and look into it and do that analysis. So yeah, I can reassure you there's not a problem with that team and they have been rectified.
And my other question is around the target. So I appreciate there's a significant decrease, but you're still way above the target. And I know the target is very low, but it's still 13 in December. I know you said it is improving. But is that on a trajectory to get to that target? Because that's a very, very strong target.
It is, although I probably shouldn't play devil's advocate in scrutiny. I do feel the target probably does need to be reviewed because we need to understand at any one point. So, for example, if this is taken at midday and we don't do allocations till 1 o'clock, we will have some people that are unallocated, but they've only been unallocated an hour. But they'd still feature on here, so I'm not sure. I think this is where we need the timescale element to give you that reassurance that these people aren't necessarily actually even unallocated. They might have been unallocated at that point the report was run, as opposed to being unallocated for 3 weeks.
So maybe a review of that data then.
And the timescales. I think we need to put the two together so you can truly understand if we've got people waiting or actually is it just in the process when the report's been run.
Councillor Roberts.
Thank you, Jake. So you asked my first question. That's clear. I think the worrying point for me there is you knew about it, which is good. That's positive. You knew, and you know that data has been fixed. But if I just looked at this without you here and looked at that data, that looks like we've got a big problem in a team. But you're telling me the team doesn't even exist. So I think it's just the importance of the data we see is really, really crucial. It's very similar to the Chair's question around the difference between 13 and 3. That still seems really high. 3 did feel quite low, but again, I'm no expert there at all. But I guess what I can't tell is whether those 13 were also in the June 44. And I can't tell how long they've been outstanding, because if all 13 of them were in the June 44, I think there's a problem. If all 13 of them are brand new in November 24, then it might not be. Yeah.
And if I may, Chair, these indicators are particularly convoluted on the basis of us trying to make best of the systems and processes that we have in place. So the new adult social care system went live 3 weeks ago. So we're currently reviewing all of this on the basis that we're now getting real-time data. So that next iteration of this will be much clearer for scrutiny members to understand exactly where we are on a day-to-day basis, as opposed to this potentially having that level of lag and inconsistency in the recording because of the level of manipulation that needs to happen outside of the system to give us the report.
Through you, Chair, something to reflect back on, I'm a big fan of recommendations, is that currently the data, it's really helpful, but the data we're being presented with doesn't allow scrutiny to make an informed decision, in my view. I'd need you right next to me to enable me to make that decision, and that's not how scrutiny should work. So maybe for the end of this piece, but so I don't lose it and forget to say it, a recommendation around ensuring and insisting that data is there.
Okay. Next slide, please.
Thank you. The next slide is sticking to the same theme of safeguarding, and this is the percentage of concerns that are triaged within 24 hours. And as you can hopefully see, this is red because the target is 80%, and in December it was 58, even I can't see it. Yeah, 58.6%. So this is one of the ones that moving forward we'll be able to, there is a table, but taken on comments from earlier, that talks about overdue. And one comment I will draw members' eyes to is in relation to learning disability, and I think that is evident in relation to the different processes. So at the moment, the learning disability safeguardings aren't triaged by our hub. And this is probably evidence in where the hub actually is having a positive effect in the other teams, and potentially because learning disability aren't included, it's having a negative impact on that team in relation to that. And that's one of the things that we will be looking at as part of the review. I can give the assurance, though, that these are all measures that are looked into. So from a risk perspective, whilst we might not be doing them in 24 hours, it will be those people that haven't been deemed high priority because they would have been escalated and dealt with. Notwithstanding that, we recognise this is an area that we really need to get on top of with the new safeguarding hub, and making sure that we're really clear that this is the target and this is the expectation, and that we're measuring them and holding people to account, or understanding why we're not meeting the timescale. Again, it is very tight. 24 hours, if you're waiting for other information, isn't going to be possible. So I think we do need to really understand is, how did we meet it in November and then it dipped? What was different? And if I'm honest, I'm not going to sit here and say I've done that analysis tonight, because I haven't, but we will, recognising it's one of our key KPIs.
2 points I'm going to pick up on here is one, that drop-off is significant at the end. You hit the target and then you fell a long way back, but I appreciate what you just said about the analysis. However, again, referring to the table at the bottom, there seems to be an awful lot going on in Safeguarding West compared to all the other areas there, and that's where there is a large amount that are outside the target. And again, all the other numbers are relatively small, so I don't know if that's a similar response to last time with the data, but I mean, that does seem a bit of a concern.
No, that's because that's where the majority all now go directly there. So they hold all of them. And that's probably one of the, I suppose, the positives of having the Safeguarding Hub is all the other metrics that I've talked about, the fact we've got the consistency, we've got a team that we can train to be really hot on process. The downside is if we have a particular increase in 1 month, they're all still going to that same team, and that is around us making sure we've got the resources appropriate. I would hazard a guess when I look into it in more detail that also from a December perspective, because of Christmas and annual leave, it possibly is to do with the Safeguarding Hub and their capacity, but I would need to verify that for you. But yeah, that is because that's where pretty much all of them are sitting, so any delays are going to be in that team.
Thank you. Councillor King.
Thank you. You kind of answered a bit there around the Christmas period. So do we have somebody who sits on the triage 7 days a week, or is it Monday to Friday?
The triage is Monday to Friday.
Which is probably what messes up some of the figures,
Possibly.
isn't it? And there's no way we're going to have a 24-hour turnaround if we've got nobody on duty Saturday and Sunday or a bank holiday.
Yeah, and I would hope on our old system it wouldn't have been able to count that well, because it probably would have counted Saturday and Sunday, whereas the new system will be able to build things like that in, so it's reflective of actual working hours and the time that they're being triaged.
Are we going to consider having somebody that would do 7 days a week?
Not at the moment in safeguarding. So what would happen if there was a safeguarding concern out of hours, it would still be picked up. So if it was an emergency or an urgent crisis situation, it would be dealt with by our out of hours team with the social workers that are on call. These generally, though, are things that are longer term or need a piece of work in the daytime. So they would deal with the immediate risk. The actual safeguarding inquiry would still then be passed to the daytime staff to pick it up and progress it through making safeguarding personal. So I don't think we feel there is a need to have it 7 days, this team 7 days, because we do have an appropriate response at the weekend and it is meeting the need that we're seeing then.
Okay, thank you.
Do we need to be measuring that stuff that's done by those out-of-hours teams then?
We can definitely, so at the moment we're working, it sits in the Children's Trust, our out of hours, and we're working with them to look through that model and how we bring the adult side back. So yeah, we can definitely provide some information moving forward, because we'll be able to track it ourselves and it'll be on our own systems as well. So yes, if that's an ask, we can definitely provide some intel moving forward.
Just to me, it appears that there's a gap there in terms of capturing the data, that the safeguarding still happens, but you don't know whether it's within those.
It will be within these. It would just then have been logged on the Monday morning, for example. The immediate risk would have been dealt with by the social worker out of hours, and then it would just then sit in these data then, because we'll then pick it up and process it on the system. In reality, we are talking very tiny numbers. The majority of out-of-hours contacts we receive are for our approved mental health service. So that's obviously someone that's in mental health crisis and needs an AMP assessment. And I think when we did through the process of working with the trust, I think we had 15, and they weren't even all safeguarding, they were just 15 adult contacts out of hours in the month. So we are talking very small numbers in total of adult. I think because generally adult services, people don't expect social services to be open. If it tends to be a crisis, it's a medical crisis or a different emergency service response that's required at midnight. But we can definitely provide some further information if people would like.
Thank you. Councillor Roberts.
Yeah, so again, it's just about increased data. So I get this is those that are outside of the KPI of 24 hours, but I don't know how many of them are 3 weeks or 4 weeks or 2 days or whatever it might be. I think you made the point that everything goes through the Safeguarding West. Well, then that shouldn't be a category anymore of a blocker, perhaps, because if everything goes into it, they're phase one of the concern, and then handing it out to each individual department is phase two of the concern. And I think the point that Anna's made about kind of 7 days, and I don't know how to say this without being horrible. I've only ever been able to get an out of hours issue dealt with by contacting Stuart. So I can't get through on the numbers that you call on the website, and you don't go anywhere. And you know, Stuart's answered the phone to me at football on a Sunday morning and got me through to the person. And don't get me wrong, he hasn't dealt with the issue. The people have called me back, but getting to them is really hard. Now, neither cases that I can think of recently were safeguarding issues, but they were both emergency issues, yeah. And I couldn't get through to anybody without going through to a director.
We'll take that away, because some of the work we're doing now is with our contact centre. So we're in the process of looking at where Call Care, who answer the phone at the weekends, sit within our structures. So we can feed that back in and advise that actually one of the feedback has been that there's been some issues with getting through to them. So yeah, because that isn't appropriate, and we do need to know, people do need to know who to access, because they are there, and there's a team of people there to respond to exactly that.
Don't get me wrong, particularly the re-enablement case, the lady that called me was available till about 10 o'clock at night. She was absolutely very helpful. It was very good. It was just that I couldn't find my way to them in the first place. So, yeah.
Councillor Humphreys.
Thank you, Chair. I just wanted to report that I didn't have any trouble when I've had to report someone out of hours, so I've had a different experience.
Okay.
Thank you. So the next slide, you'll be pleased to know, is my final slide. This is in relation to our deprivation of liberty safeguards. So this is where we're responsible for authorising people that may be being deprived of their liberty in a care home or hospital setting. So this is nationally recognised as an area of concern because of the changes in legislation a number of years ago. The next steps for us in relation to this area are we had a peer review last month, so that's when our regional colleagues came to have a look at how we're managing our DOLS referrals, our assessments, our processes. Really, really helpful. It did identify some areas of good practice, and equally it's given us some recommendations as to how we can start to try and improve and reduce some of these waiting lists. So from that, we're doing a full action plan, which will then be working through all of the identified improvements we want to make. That being said, in reality, we are always, unless we have a massive injection of new social workers and we increase this team by probably circa £1 million, I think we have to accept that there are going to be people that have to wait. It's how we're making sure, again, that the people that are waiting are lower priority, there's no risk sitting there, and that we've got that transparency and we're really clear. So, yeah, that action plan will really identify how we're going to work through these waiting lists.
So again, I'm going to draw on the table at the bottom, which says out of the 1,533, 489 of those are high. That's a third. That's a significant number that give me concern that they're of a high nature. And also, you know, I hear what you're saying about the resources, but that, you know, you're significantly above the target with no discernible progress. You know, there's slight upward tick at the end there. So again, taking into account that you don't live in an ideal world with infinite number of resources, but I would, you know, be interested to know what can be done, because that's significantly above the target. Stuart.
Thanks, Chair. In relation to kind of Dole's waiting lists, as Amy's alluded to, pretty much every authority, unless they've got money across the country, has got a level of waiting list. Now, we were planning around our improvement around the introduction of new primary legislation called Liberty Protection Safeguards. So that kind of was making its passage through towards becoming legislation, and then there was suddenly a recognition that the reforms that came with it, which were designed to make this simpler, more proportionate and more effective, actually made it even more complicated. So I think nationally there is a recognition that deprivation of liberty safeguards was set up with all good intent, but case law has bent it out of shape to the degree that there is a level of process that's required that doesn't bring about any improvement to people's lives. For the vast majority of people who are on this waiting list, there is no detriment for them, because there, to the letter of the law, is a level of deprivation of liberty in their lives. You're talking about people who might need to have a lap belt on to stop them falling out of their wheelchair when they're travelling down a corridor within a care home. Now, the letter of the law would say, we're depriving you of your liberty because we've put a lap belt on to keep you safe. That person is never going to get out of that wheelchair on their own, but the law says that we have to have it in place. So we have a Dole supervisory board in place that meets on a by-month basis that considers our position in relation to what is national guidance that's been adopted by ADAS, that recognises that this isn't fit for purpose legislation, but it's still legislation. What we do is make sure that we prioritise where there is absolute detriment, so whereby we are preventing somebody from leaving a care home because they're actively trying to leave. We have really clear plans in place. So if I'm honest, Chair, this is an indicator that we are likely to continue to see red. It is something that we need to provide assurance, probably on a quarterly basis, to Scrutiny, so that you understand that prioritisation that we have within our processes. But if I'm honest, until there is new legislation to replace this, or we put probably £1 million a year in, and it's £1 million that I'd probably spend in other places for better outcomes, this is something that's going to remain red.
So I think what might be more useful then is given those comments, is a better comparator to our peers to see that yes, this is a wide problem until that legislation changes. I think that might be useful. And secondly, to pick up the point you've just made there, that perhaps they don't incorporate this degree of common sense that perhaps they need to, it would be, is there a way that we could kind of have some narrative around that to say, well, out of these figures, exactly like the scenario you described, therefore they're not actually being deprived of their liberty, this would be normal, whereas that we are aware that there are cases X, Y, and Z where that may have been the case, because that would give us more reassurance. Because the problem with this target is that I hear all the concerns, but that's not reassuring. The narrative you've both given me is, but it's a way of capturing that. So when we're reporting back and reflecting on that, we can actually say, exactly what you said. This is a problem because we haven't got the money. The target isn't perhaps a commonsensical target, you know, and so on, all the other points. Because whilst I agree you're reporting on the raw figures, there's way more to this than meets the eye, isn't there? Which I accept. Okay. Councillor Roberts.
So the issue from, deprivation of liberty, safeguard, the whole point is that it will analyse what you've just said, though. So the fact that not putting a lap belt on that person because they're in a wheelchair so they wouldn't get out, that's a view that hasn't been considered by the safeguarding review, so we're still not clear whether we're actually removing their liberty. I have personal harrowing experience of this situation where care providers also continue to deprive liberty while they're waiting a response on occasion and, for example, thicken drinks and create dehydration instead of attempting to feed somebody. So they stop feeding, thicken the fluids, give them the fluids, depriving their liberty and choice because the safeguarding assessment's still outstanding. So I don't know how many of those that maybe there are, but the 489, I think that's where I'd like to see the further detail on. I understand, I see this data from councils all across the East Midlands, so in my day job, so I appreciate they're very similar, if not significantly worse. But I don't think we will ever get that level of reassurance while you've got 489 that have already been assessed as high priority and not understanding. And again, for me, it's the length of time they've been waiting. I don't think that's there, and that's probably the biggest indicator in all of these slides, like how long have we had 1,000, 1,500 or whatever.
Okay, so that's your last slide. Anything to sum up before we move on to our conclusions? Okay. So quite a few things I've picked out of that that I think we need to move forward. So going back earlier on, the recommendation was around doing a gap analysis of policy, just to give reassurance. I think that comes clear. I think in the case of what we were talking about earlier on, it's further clarification of these figures and what they mean. Neil?
Sorry, Chair, that's Amy's last slide. There are slides for the other IDs. I get the sense you're summing up.
Apologies.
No.
Apologies. Getting carried away with myself.
So this KPI slide is around assistive technology and the number of cases starting the service by month. And you will see that the target is 76. In December, we saw a small increase to the previous month of 4%. The average for 23-24 was 79.7, and the average for 24-25 in December was 68. So the target is actually a work in progress. So what we intend to do with the service is to look at capacity and demand and do a review to absolutely confirm with our new system and the data that we are going to be holding what the demand for assistive technology is and how many we would be expecting new referrals each month, so then we can look at an approach to be able to increase that and look at the communications that we give out to the community to promote the service as much as possible.
I don't have any questions on this slide. No, that's fine.
Okay, so
I should say the same principle applies though to the other slides on how long and things have been waiting and stuff like that. All of those improvements. I didn't want Amy to think we were just what's wrong with all of these ones and there's nothing wrong with this. There's still clearly improvements, but I didn't think the need to repeat all of those. So
okay, so
taken as read.
So slide 12 is occupational therapy timescales, so first visits within 6 weeks. And our target is 86.3 for this, and you will see that there has been a decline in this over the past few months. In December, we'll see a decrease from the previous month of 3.8%, and this is the lowest it's been since April. over the past rolling past 12 months. The average for 23-24 was 79.7 and 24-25 is 71. So as my colleagues have explained, we do have waiting well for therapy as well. So all of the people that are awaiting the service do have communication, are prioritised. So within that priority, we have a low, a medium, and a high, which people are responded to in that way. So it's our intention again to be looking at capacity and demand to review the occupational therapy services, and in April we'll confirm this so that we can have a clearer target, because again it's a work in progress target for this KPI. So also we'll be looking at productivity levels and outcome reviews. So what outcomes are people achieving through our therapy, and what differences can we make, and what changes can we make to move forward. Another thing that we're going to be introducing with our new system and our new data that we have is improvement meetings with managers. So the therapy team have never particularly done this before, so we'll be meeting on a monthly basis so that everybody can be completely informed on the data that we have, and we can make decisions together to move forward to increase productivity.
I think my clear concern there is a very steep downward trend.
Yeah.
And so, you know, that's particularly at the start of the year, you had 2 months where the target was hit and exceeded. So the fact that it's low and dropping, and it's significantly below the target, it's not even near the target, is a grave concern. So I'd like a bit more detail on the narrative around that and why that is and what's being done to address that. Because I think that's the opposite. I mean, that's really worrying. That's not reassuring at all. Okay. And then obviously, same question that Councillor Roberts quite rightly put about the timeframes and so on. Okay.
Move on to the next slide now.
Yeah.
Perfect. Right, so my last slide is visual impairment team. So this is a really, really small team. We have, our target is 80%, and in December shows an increase to the previous month that was 17.1%. So the target is a work in progress again. And like I've said for the other two areas, that we will be looking at capacity and demand. So when I say they're a small team, there are 2 members of staff, and we absolutely want to look at that development. So what we've done is that we have 2 apprentices that we're training up currently to be able to work with the team, and those 2 apprentices will be graduating in the summer, so we know then that we'll have more capacity within the visual impairment team to be able to see more people. Again, the visual impairment team will benefit from being able to see the data on our systems. I'm not going to say that again because I've said it 3 times, but it absolutely will benefit the team as well to be able to see that. And again, working with them to be able to make make informed decisions around people that are waiting, and that people are waiting well as well as the other occupational therapy. Any questions?
I'll make the same observation as the last time, so I'm not going to go again, but that's a long way short of the targets. So again, there's some narrative around that. Councillor King.
Thank you. It's good that this has come up tonight, because I actually got a compliment for the vision impairment team sent this morning. A lady in Lakeview, she's not my residence, it's not my constituency, but I've known her for a long, long time. And she actually sent, I'd like to say huge thanks to West Northampton Council Vision Impairment Team, especially the lovely Roxanne, who appeared in my life to assist. Very thorough training with the white stick and ball, which now guides me much more safely and has prevented more nasty tripping. I never knew how well we were provided for by such a brilliant caring council.
Oh, that's
there
really,
you go.
Really good to hear.
I'll forward it on to you.
Oh, yes, please.
Okay.
Thank you. Councillor Roberts.
Lovely, really nice. how can the current, unless I'm reading this wrong, and sorry, but the current month versus previous month, the previous month was green.
I think I understand that means the movement is green, not that it was green previously. So I think that's misleading.
There's a positive movement, not
So
yeah, it's
although
okay. Red now, but it's a positive movement. It didn't stand out to me as much as on the other pages. I didn't read it like that as it did here. I was thinking it's never been green. What we talking about? Again, for me, it's the number of people that are impacted. I realise that it's well below the target of 80%. I appreciate you reviewing the target, and it could be a completely inappropriate target that, but how long have they been waiting in that period, and what do the numbers actually represent? Yeah, it's a small team, so it feels like a high target for us. Well, again, I don't know what the numbers are coming in, so I can't understand whether the target's correct or not.
Thank you. Councillor Humphreys.
Thank you, Chair. Can you just flesh out what waiting well means exactly? Because it could be a sort of, perhaps a blanket term that someone could wait well, uncomplaining for months on end. Thank you.
Yeah, so waiting well is... Waiting well is a term we use in order to describe our efforts to mitigate the risk to people whilst they're waiting. It sounds nicer than it is, because our aspiration has got to be that we haven't got people waiting for support. What it's about is, wherever possible, we give people an ability to do and have a level of self-service. So if you think about people waiting to see a social worker, we signpost them through to voluntary sector organisations who might have a skill set pertaining to the initial information we've captured around their needs. It basically describes how, as I've said, how we try and mitigate the risk of actually waiting for us to take action. And it's language that's used across adult social care.
Okay.
Thank you. Just a couple from me. I always like doing them at the end, whilst everyone's really excited about the financial ones. So the financial assessments where somebody has eligible care and support needs, the first thing they need to do is tell us how much they can afford to pay. So we do that via a financial assessment. The target is that we get that done within 28 days. However, just to make it clear, the clock starts ticking as soon as one of Amy's workers determines eligibility for care and support. It makes this particular target quite a challenging one to do, because the majority of the delays in getting a financial assessment completed are because we're waiting for something, not because there's a big pile of work sitting there waiting to be done. But if we did it like that, and we looked at how long is a case that's had all the information ready, how long does that take, and if we set a target of 28 days, I'd get that to 100% really quickly. But we set this ambitiously because what we don't want to do is tell people what their charge is or how much they have to pay later, because we haven't been actively chasing the return of information, and we're not actively supporting people to get that information back. So it's always been an ambitious one. The team's had some challenges with resources, which have largely now been addressed. We've got an interim team manager who's recently started, who I'm very, very excited about, because they've got already starting to get really good grip on the performance of this service. And officer resource has largely been addressed from that as well, so improvements are expected. But the biggest improvement will be the new system. So the new system will be is going to remove so much duplication. I think probably, I would say, but I am biased, that the financial assessment team are probably going to benefit the most from it, because previously they had to take data from a report that comes out of the old social care system into Excel and then manually type it in to confirm when care started, or when somebody's no longer receiving a service, or if they haven't received all of the service they were supposed to have for that week, because all of that can impact on the bills that they receive. All of that's gone away now. So my expectation is, as a result of that, that the performance is going to start going up and up and up. We do have some options to mitigate that 28 or that lack of performance against the 28 days. But it's one that we don't really like to do. If somebody doesn't return their forms, legislation says that we can charge them the full cost of their care. We can charge them as if they have assets to pay for it, or that they've refused to return information to allow us to do a financial assessment. But in a lot of circumstances, we know that's not true. And we know that they don't have that money. And what we do is, if we took that approach, is that we create stress and anxiety for very vulnerable people who perhaps don't understand the process and need their hands holding a little bit more. So what we do in those circumstances is we look at the DWP system, and if somebody's in receipt of a means tested benefit, they haven't got capital above the full cost threshold, they're not going to be able to pay it. So those are the ones that we target more support with, to avoid that happening. But if we followed like the legislative approach, again, that would be at 100%, because day 28 comes, we mark them as being full cost and job done. But that's not the approach, and that's not our strategy for this going forwards. We've introduced weekly reporting, so the new managers introduced weekly reporting. That's going to be worked with the staff to demonstrate the improvements in performance, but also for early indication when things aren't going so well. So quite excited to see that performance improve. But I'm very much anticipating that the next time this report gets produced, you're going to see very positive improvements and things going in the right direction. Any questions?
So where you talk about they're not waiting to be processed, they're waiting for other information, is there a way of displaying that on the graph?
Yeah.
So you can actually, because my concern is the ones that are waiting to be processed, and if they're waiting, I mean, it's still a concern, but for a very different reason. So I think if there's a way of just indicating that, because that would probably give you a truer reflection and would certainly be closer to your target.
Yeah.
So if that would be possible, I think that would be beneficial, because again, it's more representative of what you're doing.
It can. It's just to point out that in the narrative, the average waiting time is 20 days. But there are some outliers, which is bringing that down. But at that point that the report was produced, there was 317 requests outstanding, but only 53 where we'd had all the information, which generally is about 2 weeks' worth of work. But it's just getting those outliers down. But I certainly can add that in there, because I think that's a good point, and it'll bring meaning to it. Yeah.
Thank you. Councillor Roberts.
Yeah, I agree, Chair. I think it's two statistics for me, the one in that waiting category and one in that we've got everything we need and aren't processing it category. Yeah. I think that'd be really good.
Okay, perfect. Okay. Then move on to the last one. Again, this one, I think for 25-26, we're going to review this one. It's a bit of a challenging one. So with a direct payment, we have to monitor what somebody spends against what their care and support plan says, and it's really important that we do that. Most people are on annual monitoring, which means on the anniversary of their direct payment starting is that we make a request for information to be returned to us. If somebody has a prepaid card, that's fine, because we get most of the access online anyway, but there's still around 50%, so probably around 450 direct payments are still managed via a self-managed account, so it's their own bank account, so we have to ask for bank statements, invoices, receipts and things like that. Once we get that information, we check what their spend is against the support plan. If everything's okay, job done, tick, they get a letter saying everything's fine. If there's a discrepancy between the two, we ask for more information. If there's examples of misuse of funds, then we send them through to Amy's team, and Amy's team will let us know how we're going to manage that going forwards. And in some circumstances, they haven't spent all their money, and we ask for them to return that money back to us. So that's kind of a whistle-stop tour of that process. The difficulty is that there's the team's built for a year's worth of work. And there are certain months where the anniversary of direct payments, there's more than others. And because of that, we always find ourselves sort of trailing, trying to play catch up. So for example, April is a very popular month for direct payments to start. So I could catch up by March, which you can see I haven't, but I would try to catch up by March. April comes and I've got more work than my team can manage in that month, which means I spend May, June, July trying to catch up on that work. So I think we do need to review that one. There has been some challenges within the team, so we'd definitely say that staff resources within the direct payments team has generally been fine, but the personal budget support service, which is the team that manages holding accounts, payroll and employee and pension services for those who want to employ a personal assistant, they've had some serious recruitment challenges this year and vacancies, and the team that are best to support them to keep them above float is the direct payment team. So we've had to repurpose some staff and try and keep them up, which is why the stats are even lower than I would expect them to be. Those resources issues have gone now. There's less time being spent by the direct payments team supporting that other team, so they're on their path to recovery. So again, I would expect it to go up, but for 25-26, because of what I've explained to you, I will probably look at redesigning that key performance indicator that gives a bit more of a true understanding of what that team's performance is.
When you were there in January 24 and you hit the target and then it suddenly dropped,
It corresponds with the disaggregation of the personal budget support service.
So that's the direct correlation.
Yes.
Okay.
Yeah.
That's my only comment. Councillor Roberts.
Just quickly, nothing on the stats, but just that the staffing issue therefore puts you at significant risk, because if your staffing levels change, then this KPI is always at risk of being achieved. So I guess my concern is that we're not building enough resilience into the other team that you mentioned, sorry,
personal
Ashley, personal budgets service. We're not building enough resource, resilience into that service so that you'll always rely on your direct payments up. And the problem with this is direct payments can be such an emotive area that actually not having our data up to date can be a real problem with a complaint that we don't need and we shouldn't actually be receiving. So.
Okay. You done? Stuart.
I just wanted to say that whilst that might have felt a bit painful, we purposely put forward the reds. What we didn't want to do is kind of congratulate ourselves on the kind of greens. What we wanted to do is embrace this notion of transparency, because actually it's these ones that we need to be walking through with you to provide you in future sessions that level of assurance that we've got a real grip and that we're driving towards an improved trajectory on them. So whilst that might have been a bit painful in places, it's a helpful process for us. Thank you.
Councillor Roberts.
Chair, just really quick, because obviously I won't be here next year in my last scrutiny, and I just want to say that the reflective nature of the way in which you approach this, you know, it's fine for us to see reds. That's the whole point, for us to look at scrutiny to say we're learning something from the things that we are being challenged by. So I just, you know, genuinely commend the difference between my day one scrutiny and my final day scrutiny is massive in this particular area. I'm not going to go with anywhere else, but in this particular area, it's massively different. And I, for one, as a councillor, appreciate your reflective nature and the fact that you're still here at, 8 o'clock at night when you've been at work all day as well. So thank you.
And I'm also appreciative of the fact that you do display the data like that, because it would be very easy to talk about all the champion. We've won this, we're doing really well here. My only observation generally would be, what perhaps might be useful is to frame it with like a balanced scorecard approach to say, this is where we are overall, then have the deep dive we've had today, because what I don't want to ever lose sight of is those successes. And obviously I want to see the reds decrease over time, but actually, to echo Councillor Roberts' point there, I'm really happy that you are highlighting those and you are taking that approach, because it means that you're not ducking or hiding any of the issues. Okay, is that the end of the KPIs? Lovely. Okay, so to go back to the bit I leapt to earlier, which was recommendations and how we move this forward. So I picked up a couple of points there, and Councillor Roberts, I might let you fill in if I've missed any of the recommendations that you were putting forward earlier. But the gap analysis of the policy, I think is a recommendation that I think is really positive, and I think something we should do just to make sure that all the I's are dotted and the T's are crossed. I made a note about safeguarding, so forgive me, Councillor Roberts, if I've forgotten what that was.
Forgive me, Chair, because James normally writes them down, and so I didn't scribble, because he normally reads them back to me almost as if I said it. So I severely apologise, James, if that's not what you've done today.
I think it's regarding Comcare, wasn't it? Picking up. Was it regarding Comcare?
I haven't got the slide now. Out of hours, safeguarding, yeah.
Yes,
thank
yes,
you, Matt. Yeah.
Yes, that's what we got.
So getting through to the out of hours processes and ensuring consistency of that. I think Rosie reported something good, but Anna was sharing same concern as me on that point.
Yeah, understood. And then there was also to do with improving the data. There were some data quality issues where the data looks probably worse than it is because of where the days end and how that's captured. So I think we'd like to see some improvements around that. And then in one of the previous slides, we was also talking about deprivation of liberty, and again, better understanding of that data where the challenges you have with the legislation are causing problems. I think that has probably captured it. If there's anything else I've missed, please let me know.
Well, I think that Ashley will probably pick it up anyway, but I think that last one around separating that KPI is actually quite crucial to, your staff, never mind anyone else. So,
agreed. So, does that make sense, James? Have you captured everything there?
There was a lot in there, Chair.
There was, yes. Apologies.
I think there were some general themes around, as you say, enabling scrutiny to get a better understanding of the data without the need to have an expert literally sat next to you, contextualising it. There was a recurring point around the length of wait, which applied to many of them. Sorry, just trying to check back through.
Through you, Chair. That one's really important, actually. And I think Anna's just said it should be just apply all of those KPIs should have that length of delay.
Absolutely, that's a recurring theme.
Added as a recurring theme.
Yes, absolutely right. Agreed.
That makes it easy for you, James. All of them.
No.
Ditto.
Yes.
So is committee in agreement that what captured and those are the actions that we'd like taken out? Thank you. Yeah, was that okay? Well, thank you, all the officers there for persisting with that. It was a very long session, but I personally found it very useful, and I can see from the reactions around the committee that we all found that a very useful, very, very rewarding session. So thank you very much. Thank you, mate.
Then we haven't finished, Chair.
No.
Unless members need to go, then.
Ray, you're not going, are you? You can go, yeah. Just make sure you're not going.
No.
The members were staying.
I just did, because he's
No,
leaving.
that's fine.
Make sure
Absolutely.
what I need to do with some of these things.
I've got childcare issues by 8 o'clock, so I need to really go, but I will catch up and find out.
Yeah, thanks, Rafia. Yeah, much appreciated. Are we time bound? Do we have a limit?
No, I don't think so.
That's fine. Okay. Well, thank you very much. So on to item 6 on the agenda, the annual report of the committee, which I hope you've all had the opportunity to have a look at and review. From my point of view, I realise we've actually covered an awful lot of topics in this year. Support for unpaid carers, adult social care performance, supported living, palliative and end-of-life care. Northampton General came in to talk about their priority and challenges when their new CEO had arrived. direct payment policy, local area partnerships, and adult social self-care assessment, as well as, for me, my personal highlight was the framework for adult care, because I think that was a major piece of work. So I'm not going to go through it bit by bit, but welcome questions and observations on the report.
I don't want to keep everyone waiting. One line in the local area partnerships, it says committee members sought reassurance that the operating model would take account of forthcoming changes to WNC ward boundaries. I can't recall what the position statement was on that, but in the lap we're being told it won't. So if we don't know that, I haven't got clarity on that, I think we should add a sentence to say clarity on this is going to be of the utmost importance, because the police service and the fire service have changed their reporting boundaries based on our current ward boundaries.
Yes.
So Briar Hill, for example, falls into Sixfields and is reported on a different category of data in their system than it is or will be potentially in our system if we change our boundaries to support the new ward boundaries.
So I've got some of your data, have I? Yes, that's absolutely fine.
So the police think we're not going to ask them to now restructure their whole computer systems and their staff base again. I don't see how we can. We can't do that. But that line suggests that we got reassurance that was the case, and that just, when I read it, that made me nervous. We didn't. I certainly have never been given that.
I think that's a fair observation. Yeah, I think if we could put that in, please, James.
But other than that, Chair, nothing else. And I just wanted to say thank you for the way in which you've chaired the meetings. I said it at full council the other night. I think they've been, not that they weren't inclusive before, but I feel that they've been really inclusive since your tenure, and the ability to create recommendations has been much easier as well. So.
Thank you very much. I really do appreciate the feedback, and I really did appreciate that comment at full council, so thank you very much. Duly noted.
Through you, Chair, just to highlight as well, the final version of the annual report will also need to be updated to incorporate the previous discussion at tonight's meeting. So ideally, you would want your annual report to come to a scrutiny committee meeting for approval after all the work has been done. In practice, that wouldn't be a good use of your time, because you'd have a meeting to approve an annual report. So whatever other amendments are added to it, and Councillor Roberts has raised one, there'll also need to be some further text added to reflect tonight's extensive discussion.
Extensive, yes. Would we collectively get that circulated to approve? Would that how that would work?
A further draft can certainly be circulated to you. I think in practice we would be looking, in effect, for the committee to agree that if you're happy with it, then that's the final version.
I certainly think with Councillor Roberts' change is a good one. I think it would only be how we summarise this evening, which people might want to see before it goes in, because that's not in the report currently.
No, quite. So absolutely can do that.
Through you, Chair, I think in the absence of a response from any of us, though, within a reasonable period of time, we delegate authority to itself to sign off.
Thank you, Councillor Roberts. Councillor Humphreys.
Thank you very much for this report. Just a really quick question. It's the first annual report. Just wondered what, any particular reason why there wasn't one previous years. Thank you.
That is a very good question.
There was one last year, but I think we got somewhat out of sync. I think the annual report on 2023-24 ended up going to full council in autumn 24, so ideally it would have been earlier. I mean, we had the situation where formally it went in Councillor Herring's name as the chair for that year, some months after she ceased holding that role. So yeah, it was the second annual report from this scrutiny committee that this one is, rather than the first.
Point though, maybe we should change the wording to that, because I just read it and went, well, it was because of the committee changeover name, but actually it's not, because part of the year was reported on in the report that Rosie did. Is that right?
I think I don't think
or does it not matter?
I don't think there's been a crossover in the work done. So the 2023 annual 24 annual report only covered work in that year. The issue was it wasn't presented to full council until a couple of months into 24-25.
Understood. Sorry, James.
There's a crossover in the presentation of the reports, not in the work covered between the two reports. So the committee wants the draft updated to pick up Councillor Roberts' point about lap boundaries. It wants and it notes that there will need to be some further text added to capture the previous agenda item. It wants the updated draft to be circulated to all members, but it's effectively agreeing the report today, subject to those additions, and is happy that you'll sign off the final version.
Thank you, James. Thank you. Thank you, everybody. And that moves on to item 7 on the agenda, review of the work committee programme, which again, I'm assuming everybody's seen. That was in the minutes. Has anybody got any particular comments or anything that we need to move forward? James?
I mean, you might raise the question about why a work programme item is being reported to the final meeting of the committee. The focus of this is really on if there is anything that this committee wishes to highlight to its successor as something you would like to see scrutinised. I mean, a large part of the existing work programme of this committee is there are some recurring items. There are some items where the committee has said revisit this some months hence. So if there's nothing more specific you want to say, then this committee's existing work programme could be presented to its successor for it to take into account when it feeds in, when it considers what it wants to do. I mean, it's absolutely the case that a scrutiny committee's work programme should be what it sets, not something it feels that it's inherited or it's obligated to do. Equally, it's very good sense for the new committee to take account of what's gone before and what its predecessor has done. So if there's nothing more specific the committee wants to highlight, its work programme can be presented to its successor for consideration.
My personal feeling is looking at the work programme. I think we have set out what we would like our successor committee to undertake, and I think items that may have come out of tonight, I think we have already asked those individuals to bring stuff back. So I don't believe, again, I'm happy to defer to anybody that might think differently, that we probably have everything covered, and was probably, with our report and the work programme, is a good handover for our successors. Councillor Roberts.
You won't be surprised, dead quick. That we recommend that report, that scrutiny of adult social care remains as a standing item. I think if they stop that, if the next committee stops that coming to committee, we lose sight of something we spent 18 months or more trying to create, and I think it's been really beneficial. And
agreed
to do.
Yeah, agreed with that. And the other thing that I'd nearly forgotten because it was 2 hours ago was follow through on the CQC. So that they did talk about having visits in August, so they would get their reports in the autumn. Yeah. So I would like to recommend that comes to our successors' work programme in the autumn.
Definitely.
Just on a specific item, Chair, the current work programme does have. You referred to it earlier, the previous scrutiny work on the supported living services and the new commissioning framework. There's a suggestion in there that the committee holds a further task and finish style meeting on progress with the delivery of that during March-April 2025. That may have been a suggestion made in the past that's been overtaken by events. Given
I would agree. If everybody else is of agreement, I think that's the case.
It's been overtaken by
yes.
events. Okay, no, that's useful. Thank you for clarifying that.
Okay.
Thank you.
I don't think there's any further on the work programme. I don't believe we have any urgent business.
No.
So I will close the meeting. I will thank you all for your attendance. I've really enjoyed chairing the meetings, and the only thing I would like to say is, can we all have a selfie before we all go?
If you're able to reduce that for me. don't know where it's come from.
2 ticks. Let's get a picture, right? And I'll sort you out.